details on my tie. September winds down and we move into October. We move into real basketball season. For me, basketball season is 365 days a year, but it's going to be on television. I have 5 topics that I talk about. Basketball climbs very close to the top of the list this time of year, but we're going to deal with my all-time favorite number 1 topic, which is chiropractic. Hi, my name is Gideon Orbach. I practice chiropractic here at the World of Wellness. I recently, as in the last couple weeks, celebrated my 15-year anniversary with this organization. So that means that I had a chance to practice with Dr. Weiner, both on the south side when we were the pain release clinic, and here in this building when it was the Weiner Wellness Center. And now I have the privilege of practicing at the World of Wellness, same place, same people, actually a lot of new faces, but the same principles. Jamie Dorley bought the business. He's in charge now. I know that a lot of you who've been listening in for a long time know Jamie quite well. We still and continue to promote the nutritional frontiers amongst other brands of nutritional supplementation. But over the course of this wellness week, there are 25, 30-ish presentations, and the vast majority of them are about nutrition and topics in nutrition and body chemistry. I'd like to talk about body physiology and some neurology and what chiropractic is, or at least what it is as the way I practice. I have a nice pedigree. I've trained underneath some incredible people. I learned how to I went to chiropractic school at Cleveland College in Kansas City. It was in Missouri at the time. Now it's in Kansas. I trained with the Motion Palpation Institute. The director's name is Mark King. He's a close friend and mentor of mine. One of the premises of motion palpation is it's an exciting day when somebody you mentored is up front teaching the class and you can sit back and relax. And I was very lucky. I was really, really lucky to have that experience earlier this year. I attended one of the motion palpation technique classes, and one of the doctors who I helped him find his way at the beginning, he was teaching the class, so it was a proud moment for me. I've also done a lot of training with Mark Charette. He teaches extremity adjusting primarily. He's a world-renowned chiropractor to the extent that he has a license to practice in other countries. I trained under a gentleman named Dr. Jeff Hagquist with his people in Washington, D.C., who taught me how to do the stretching maneuvers that I like to use. I trained under Dr. Peter Levy and Martin DeCourcy in dynamic trigger point release. That means that we're finding trigger points, muscle spasms in the body, and setting the muscle that's involved through a range of motion while we get those muscles to relax. I learned clinical examination and clinical thought process from both Ted Carrick and Ken Erickson. I want to highlight Ken Erickson, that all of these people that I mentioned and all of these organizations that I have been and continue to be a part of, people teach and practice internationally, work with patients of all demographics, which is exactly what we do here. I see patients who are as young as their ages can be measured in months, and I've seen patients who have completed 9 decades and counting. So it's a very nice demographic. It's a nice mix of patients for me. It's fun to come to work every day to see those people. But I guess the million-dollar question is going to be, what is it that I do with these people? From a clinical perspective, I want to sum this up in one very simple sentence. I like to help people feel more comfortable living in their bodies. And then we can build on that, but what it comes down to is, what strategies are we going to take today? Which techniques am I going to be able to use with you today? Possibly which exercises am I going to instruct you in? That what it's going to come down to is, how do you feel more comfortable living in your body? We want to increase brain-body communication. We want to increase the brain's ability to receive messages from the body. We want to increase or better people's ability to breathe deeply, to stand with good posture, to move freely and easily and not feel like they're tight, ratchety movements. We want to just generally and specifically help people feel more comfortable living in their body. So let's drill down on that just a little bit. These are the things that I do. I do muscle release technique. I'm not a trigger point therapist. We've had in the past some very talented therapists here. We have in the present a very talented therapist here, Andrea. I don't think anybody can replace Jacob or Herman or Adam, but Andrea has certainly picked up the ball and ran with it. I'm a big fan of her work, so please don't let me confuse myself with what I do with what she does. But trigger point therapy, muscle therapy, is a slow treatment. What that means is we're going to find trigger points. These are little places in the body where a muscle is adhesed to itself. It might be adhesed to the fascia. The fascia is a very well lubricated skin or film that will allow muscles to glide on top of each other. And then underneath the fascia, we're going to have a secondary layer of muscle. So this is how we have stacks and tiers of muscle that move with one another. And what happens is, whether we're dealing with an injury or dehydration or a nutritional deficiency, muscle will have a tendency to tighten, and it'll get sticky to the fascia, and that will in turn stick the next layer of muscle to the fascia. And now we have this muscle fascia muscle sandwich that's pinched together. So if you could imagine a ball of saran wrap, a very well lubricated ball of saran wrap that we're trying to smooth out, that's what trigger point muscle therapy is. So when I do my trigger point, I'm looking to set muscles in their ranges of motion. So for example, if the muscle in your shoulder that would bring your arm backwards is tight, I'm going to find that muscle or that group of muscles, and I'm going to press on it while the patient slowly retracts their arm. And we do this certainly not in slow motion, but in slow, deliberate fashion. The other technique that I like to highlight that I do is I do what I call active isolated stretching. Some people call it PNF, proprioceptive neurofacilitated. Some people call it pin and stretch. We're really essentially talking about the same group of techniques, different guru, different name for the maneuver. So what happens with these techniques or these stretching techniques is the muscle has a lot of what's called elasticity to it. It has a lot of stretch capacity. Muscles connect to tendons, and then tendons connect to bone. The tendon is a fixed length, so the tendon is going to guard against the muscle being able to achieve a full stretch. So what we do is we use a series of neurological reflexes to essentially shut down the tendon so it won't inhibit the stretch. This will allow us to stretch muscles through a greater range of motion than previously. Now, those techniques are done much faster than trigger point therapy, but they're not quick like a chiropractic adjustment. The chiropractic adjustment, the third maneuver that I have in my bag of tricks, whether we're talking about the spine or the extremities, I could be adjusting somebody's foot, somebody's knee, their shoulder. It really depends on what I'm finding with that specific individual at that particular time. Clinically speaking, is done very quickly. A chiropractic adjustment is what's called a high velocity, low amplitude thrust. That means that we're going to do a very quick pressure push thrust into a body, but we're not going to push very deep into it. We're going to push very superficially. Now, what's the deal with these three different techniques and three different classifications of maneuvers at different speeds? Every single maneuver that I use in my clinical experience is designed to stimulate the central nervous system. And the way we do that with these techniques, with these physical maneuvers, is we do excitation of what are called receptor pools. Receptors live on the nerves. There are little pieces of tissue that live on the nerve that are essentially docking stations. So a receptor's job, and when I say the nerve, I should actually mean what I mean is a cell. It lives on the nerve cell. We have receptors on every cell of the body. I'm particularly interested in what's going on with nerve cells. So what happens is that the receptor will receive information. In the case example of what is chiropractic care, the information that it receives is going to be pressure-sensitive receptors. We're going to have stretch-sensitive receptors, and we're using slow motion and quick motion pressure, and we're using medium speed stretch to excite these receptor populations. And what happens is these receptors receive the information, be it pressure or stretch, and they transmit that information into the nerve itself, and the nerve carries the message into the spinal cord, and then the spinal cord travels up the length of the back to the head, and it gives that information into the brain. Much more on that to follow. So what we're doing is we're taking advantage of the body's receptor pools, and we're using them to send the messages that we want the brain to receive in order to stimulate the brain, in order to reestablish brain-body communication. So when a body part, when a limb is dormant or it's not being used properly in a form of a repetitive motion style of activity, or maybe it has mechanical trauma such as a fall or an accident or being struck in blunt trauma, we're going to lose motion. We're going to lose range of motion, and those pressure-sensitive and stretch-sensitive receptor populations and those pools are going to stop firing into the central nervous system. And from a chiropractic perspective, it's our job to wake them up. Why is that so important? Well, we'll get to that shortly. Now, as I said at the very beginning, my clinical goal with every single patient is to help them live more comfortably in their bodies. That means that we're doing mechanical techniques to help improve their ranges of motion, to help take pressure off of their body and allow their bodies to move freely and easily, to excite their central nervous system, their brain and their spinal cord, so that they can move freely with intact brain-body communication. Sometimes we have to do exercises to reinforce what we're trying to do clinically. So yeah, there's an element of homework when you work with me. And my exercises are simple. I like low tech, meaning no equipment necessary. If you need to use equipment, I'm going to suggest something like a towel, a wall to push against. Occasionally we use ice. If you don't have the recipe, give us a call. We'll have that on file for you. If you don't have a wall or a towel, we'll find a way to get you one or use one of ours. Those are the extent of the equipment that I like to use. So regardless of what injury somebody might have, we can be talking about a sprained ankle. We can talk about posture-related neck pain, anything in between. The first thing we have to make sure that we do is that the patient can balance themselves in the Earth's gravitational field, and two, that they can breathe deeply and efficiently. So one of the things I like to do with my patients as much as possible is we do deep breathing exercises, and that's exactly what we're going to do right now as a group. So what I'd like everybody to do is focus on the region of their body where their abdomen and chest blend into one at the bottom of their sternum, and place number 2 is going to be their belt buckle. We're going to call this the abdomen. And what we want to do is we want to initiate our breathing and make these mechanics come from our abdomens, not from what are called our accessory muscles of respiration at the bottom of our neck, at the top of our chest. We're not going to use muscles in our neck as a pulley system to lift our rib cages up. Rather, we're going to engage our diaphragms when we breathe deeply. So what I want anybody to do is I want you to think about this region where the top of your belt buckle may lie and the bottom of your chest may lie, and I want you to push it out as far as you can. And now I want you to squeeze it in, and if you can touch your spine with your belly button, you're doing pretty good. Push it all the way out and squeeze it all the way in. Now this time, when we push our abdomens out, what I want everybody to do is inhale through their noses. Now you'll notice I'm not inhaling great big and exploding upwards like so. I'm inhaling through my abdomen. So I'm pushing my belly out to create space to put that oxygen in and to move my belly out of the way to give my lungs room to sink in and room for my diaphragm to sink in. Now, I'm going to do the exact opposite. I'm going to blow out through my mouth and I'm going to squeeze my abdomen in. From the profile. Inhale. Exhale. So now that we have that demo out of the way, let's do a couple of these together. Please, everybody, make sure to keep your shoulders at the same height that we're starting at. We're not shrugging up. We're not going to do this. We're going to use our abdomen. So big, deep breath in through your nose, pushing your abdomen out. Let's hold. 1,001, 1,002, 1,003. Now blow out through your mouths and sink your abdomen in, and let's move slowly. One more time. Big breath in through your nose. Abdomen is expanding. It's expanding some more, and we're just going to hold it right where it is. 1,001, 1,002, 1,003. Now blow out through your mouths as you pull your abdomen in towards your spine. One last time. Big breath in through your nose. We're expanding, holding some more, and blow out through your mouths. Okay. In a pre-COVID world, we would have a room full of participants, and I would survey the crowd, and I would say, how do you feel? And people would say things like, wow, I feel really good. I feel light. Well, that's a perfectly good and fair way to describe what's happening here. As we get more oxygen into our bodies should become more efficient. We should work more fluidly. So you might feel pretty light and easy after a couple, 3 deep breaths. Some people say, I feel like I have a little bit of a head rush. Well, that might be because of a temperature change, because of how an internal temperature change, because of how your body is working to get all of that air in. And it's a sign that you're probably not used to this and may think about taking a couple moments every day to be a deep breather in the morning, another few moments in the afternoon, and a few in the evening until it becomes your normal. Now, as I mentioned, I practice chiropractic. I do mechanical treatments. I examine people. I figure out what's going on with them physically, and we make physical corrections. Now, I can't say every day, but I can certainly say more than once or twice a week, we see patients who have headaches. People who sit at desks, people who drive, people who are sitting in a posture where their head is far forward. They're collapsing the top of their chests. They're breathing very shallow. They start to develop muscle spasms in the musculature of their neck. They start to inhibit the movement of the vertebrae in their neck and their upper back. As they scrunch themselves in further and further, they start to inhibit their rib cage's ability to rise and fall with respiration. And the headache is the symptom of these mechanical deficits and these aberrant postures and aberrant mechanical movement patterns. So what do? We do the appropriate hands-on care, including a combination of trigger point therapy through a range of motion to open up their chest cavities and move this from this scrunched in position to this up and tall position. We do trigger point therapy to get the musculature of their neck that's fatiguing to relax, because it's fatiguing because it's being used to pull the ribs up with respiration. We do chiropractic adjustments to the rib cage to reinforce this position. We do chiropractic adjustments to the joints in the neck that have become lackadaisical in their movement pattern, that have become certainly maybe adhesed in the sense that they don't rotate, flex, or extend the way they're supposed to. And what happens? The patient starts to improve their condition, the symptoms, the headache, they start to go away. We usually have to do a couple, 3 treatments. And then we give the patient some responsibility. We put some work in their lap in terms of work that they have to do to reinforce these conditions. And where does it begin? It begins with the same deep breathing exercise that we just talked about. Now let's drill down on this deep breathing exercise a little bit more, and let's talk about posture. If we think about good posture that you're comfortable to stand in for prolonged periods of time, or to sit still in long periods of time, we want to first of all think about our torsos being up and our weight evenly distributed over our feet, so that we can hold ourselves in this upright position. So let's do this. That same abdomen area that we talked about in the context of breathing. Bottom of the sternum, top of the belt buckle. Let's start by making ourselves as tall and as long as possible in that abdomen. So what I'm going to do is, you can see my 2 hands are at my belt buckle and at my bottom of my sternum. I want to separate I don't want to move my hands, but I want to separate them as far and get as much space in between them as I possibly can. So I'm literally stretching my abdomen up. And when I do that, I feel my shoulders, the upper half of my torso from the bottom of my sternum up, kind of rocks backwards, which is exactly what I want. Now, I have my torso in a pretty good position to maintain this posture. What am I going to do with my head? If I could imagine a string coming from the ceiling attached to the top of my head, pulling it up. So I'm making my whole self long and tall as possible. If you go to the doctor's office and they're going to measure your height, everybody wants to squeak out that last eighth of an inch. Where does that arm from the scale come? Right here, the tallest point on my head. I want to stretch that up to the ceiling as much as I can while maintaining this length in my abdomen, while allowing my shoulders to continue to fall back. And now that is going to put my torso pretty much right on top of my hips, right on top of my feet, and I can just stand here and feel comfortable for a prolonged period of time. So if you're feeling really good about this, first of all, you can do the exact same thing in the chair, minus the feet, hips, and the lower body alignment, but you can sit up straight and tall in your chair in this exact same posture if you're listening in to me from a sitting position. And let's maintain this posture, and let's do 2 or 3 more deep breaths. So once again, here we are, long in the abdomen, tall in the abdomen. Deep breath in through your nose. Hold it, 1,001, 1,002, 1,003. Out through your mouths and sink your abdomen in towards your spine without losing the length. And let's do that again. Big deep breath in through your nose. Hold it, 1,001, 1,002, 1,003. Out through your mouths. And once again, if we had a crowd of people here, we would drill down on this and get some response. But historically speaking, if you're listening in and you're participating with me, and if you're enjoying the moment, or if you're enjoying your pro reds mixed with pro oranges. I'm not a big talker. My voice gets tired very quickly. My favorite drink of all time is water. And when I spike it with pro reds and pro oranges and sometimes the greens, all from Nutritional Frontiers, hey, I'm just getting more nutrients and I'm still getting all that water that I crave. So we're going to drill down on this for a second. And when we did this with a large live audience, we would talk about, well, how did the deep breathing feel while you were focused on your posture? And almost always, to a man, to a woman, the answer is, oh, it felt so much even easier. I feel even lighter. I feel like I could sit in this posture. I feel so well balanced. I could stand in this posture for a very long time without fatiguing. So once again, what are we about? We're about helping people feel more comfortable living in their bodies. Don't you think that being able to be a deep, efficient breather by standing in good posture or sitting in good posture that prevents you from fatiguing would help you feel a little bit more comfortable in your body? And that's not something that I'm going to do for you. That's not something that you have to come to the clinic for. That's not something that you have to see a chiropractor for. The good news is that piece of the puzzle, that's in your hands. I used to host this workshop, and I would have everybody like sign on a form that I promised to do the exercises that Orbach assigns me, and they would do a little prick and seal it with their ink. And I know that I have legions of people out there who came to see us in a pre-COVID world who would be doing their posture and their breathing exercises that I made them promise to do. And I'm looking for more people to sign that form. So if you're listening in from anywhere that the internet will reach, if you're listening in from around the corner, if you have an appointment with me later this afternoon, this is good news. This is something that you don't need anybody else to do for you. This is empowerment. This is what you can do for yourself to help yourself feel more comfortable living in your body. So when COVID happened, a whole group of people went from working in the office to working at home. And they had to figure out how to make their home workstations as comfortable, as easy, as user-friendly as possible. And we came up with a pretty good workshop. We had an entire presentation that was all about how to build a home workstation and to be comfortable and to be efficient and build it yourself and what you should be looking for. Now, because of the economy of time, we're going to give the top couple of tips that we built the workshop around. The first thing is you want to look for a sit-stand desk and spend as much time doing your work as possible standing. If you've really been following along, yesterday I had the opportunity to participate in a couple of roundtable conversations with Joe Messino, and we were sitting right here at this table on tall chairs. Today I made special requests. Can I please stand to do my workshop? And IT savant Phil rolled his eyes at me, but he was very accommodating because he maneuvered the camera around, maneuvered the microphone around, and figured out how to make it happen, because I'd like to illustrate that everything that I'm presenting to you, including the deep breathing exercises, especially the posture exercises, can and should be done standing. So golden nugget number one, if you're working at home and you're building your own workstation and you're responsible for your surroundings, I can't emphasize this enough. Having a sit-stand desk and being able to alternate the height and the sitting and the standing, great thing to be able to do. Second thing to be aware of, it sounds like a no-brainer, but it's not, is your light source. Think about your computer monitor. Where is it relative to the window, relative to an overhead light, relative to the lamp? You don't want to have a glare blinding you coming off of your computer screen. Okay, well, this is great. There's an element of audience participation here. IT savant Phil is monitoring the keyboard over here, and people are welcome to type in their questions, comments, even moral outrages. And we have a question, sir. That's a great question. The question is, how often would I recommend doing these breathing exercises? And the answer is with every single breath that you take. And at a certain point, it stops being an exercise and it just starts automatically being how you breathe. So let's do this. I recommend that you sit down or you stand, preferably standing in good upright posture with long torso, and take 3 to 5 deep breaths. And you start off by doing that 5 times a day. And the amazing thing is, it'll become something you're hungry for. Your body will thirst for more deep breaths. Your body will tell you how often to do this. Your body will tell you when you're breathing too shallowly. So as a start, 3 to 5 deep breaths in a row. Do that 5 times a day. And I can't say that within a matter of a few days, every single breath you take will be a deep diaphragmatic breath, but the changes that you're going to start to feel in terms of your systemic relaxation, in terms of how your abdomen feels, in terms of how your chest feels, in terms of having so much less pressure at this spot in your neck, in the front, and the corollary spot in the back, that's going to happen very quickly for you. Thank you so much for asking and joining in and opening the door to make this interactive. So, back to the workstations. If you find yourself sitting, we want to have the rule of 90s. So I want to have a 90-degree angle between my foot and my shin. So I'm going to bend my ankle on the floor to 90 degrees. I'm going to have a 90-degree angle between my knee, between my shin and my thigh. I want to have a 90-degree angle between my thigh and my torso. And then I want to have 90 degrees at my elbows when I'm typing. Upper arm, lower arm, 90 degrees. So if you honor the 90-degree principle, that will tell you exactly how high your chair should be and exactly how far away from your desk you should have your chair. Once again, these are things that you can do for yourself. These are things that you should do for yourself, especially if you're a home worker. This is about empowerment, things that you don't need me or any other chiropractor or Andrea for. That's the good news. You can do this for yourself. Now, my favorite chiropractic topic, those pressure-sensitive joint mechanoreceptors. I promise to come back and drill down on those. We talked about using a combination of slow technique, medium speed technique, and fast technique to excite different species or different pools of joint mechanoreceptors. through mechanical means. We're going to do the pressure sensitive and the stretch spindles. And what we're going to do is we're going to use those as tools to influence or to stimulate the central nervous system, the brain, and the spinal cord. Now, my mentor, Mark Charette, explained this as having mechanoreceptors as being the little angel sitting on one shoulder, and nociceptors, the little devil sitting on the other shoulder. So nociceptor comes from the Latin nocere, is to harm. When you have body tissue that's disrupted or injured or even destroyed because of a slip and fall, because of repetitive movement, because of trauma, because of a deficit of oxygen, that's a big one. Why do we do our deep breathing exercises? So we don't have oxygen deficits in our bodies. What happens when we have oxygen deficits in our bodies? We activate nociceptors that signal harm. Change in pH, change in temperature. Those are all potential activations for nociceptor populations. So what happens on nociceptor? Remember, this is harm. They travel along very similar pathways through nerves into the spinal cord and up to the brain. Nociceptors, when they signal that something has been damaged, when there's tissue damage, it's highly likely, highly probable that they're going to start initiating a sensation of pain. Something like 2/3 of the nociceptor population travel through the brainstem on its journey up to the brain. The brainstem is what? Modulates breathing, heart rate, digestion, ability to sleep, ability to see. Anybody who's in real pain disrupts their ability to sleep, doesn't it? Have you ever met anybody in severe pain whose heart rate went down? It happens very infrequently. Blood pressure has a tendency to go up. Heart rate has a tendency to go up with pain. So we have all of this tissue destruction signaling passing into the brainstem, causing collections of more symptoms that we want to get rid of, that we want to fix, that we want to make better, on its way to the cortex, where pain sensations, nociceptive activization, can ultimately influence cognitive thought. You see people who are in pain making some bad decisions. Wonder how that happened. Those nociceptive activization pathways stimulated the central cortex, the areas of the brain where we have rational thought, in a harmful way. So what tools do we have to shut down those nociceptors? Well, we have joint mechanoreceptors, muscle spindle cells, the very receptor populations that I like to talk about in the context of what is chiropractic care actually doing? What are we doing with an adjustment? We are inhibiting those nociceptors at two levels. We are blocking them at the spinal cord level so that they don't actually get a chance to take off and travel all the way up into the brain stem and then following all the way up to the brain. So we have joint mechanoreceptor activation, angel on one shoulder telling the devil on the other shoulder, sit down and shut up. Stop making all this noise. Stop causing us bad changes in heart rate, inability to sleep, inability to digest, possibly inability to have rational thought. That's joint mechanoreceptor level 1. Joint mechanoreceptor level 2 follows similar pathways up into the brain, and it helps to stimulate the thalamus. The thalamus is like grand central station of the central nervous system. All of our sensations, with the exception of smell, come into the thalamus. So, if you are, if you're having a chiropractic adjustment, and you finish off with your adjustment, and you say, I feel like not only can I move my neck and my back feels freer, but I feel like I can hear better. I feel like I can see better, more clearly. My senses seem more alert and more awake. This is amazing. I feel so good. Which I'd like to thank one of my specific patients who knows who she is for saying, "Wow, I can hear the color, after she was adjusted. What's happening here is we're stimulating all of our sensory awareness systems. We are keeping our mechanoreceptors active. We're keeping our nociceptors suppressed. So we're probably inhibiting pain at both the spinal cord level and the brain level. We're influencing better ranges of motion. We are influencing a better way of feeling more comfortable living in our bodies. So before I wrap this up, if I could have IT Savant Phil check the monitor and see if there are any more questions. I want to make sure that we do this breathing exercise one more time. So everybody, please stand or sit so that you're long in your torso. Remember, we're taking the area of our abdomen from our belt buckle to our bottom of our chest, the bottom of our sternum, and we're going to make ourselves as long as possible in that section of our bodies. We're going to let our shoulders just drift back, and we're going to take a deep breath in through our nose, and we're going to allow this area to expand. And we feel this stretch in our abdomen as we push our bellies out of the way, creating physical space for our lungs to expand into and for our diaphragm to sink into. And now we're going to squeeze that area into our bodies. If we can touch our vertebra with our belly buttons, we're way ahead of the game as we blow out through our mouths. We're going to do that again. Big, deep breath in through our nose. We're expanding. We're holding this. We're holding that position. And let's blow out through our mouths. And we're going to do that one more time. Deep breath in through your nose, expanding your abdomen. We're not going to shrug our shoulders up. We're going to allow our shoulders to keep sinking. And our bellies come out. Hold 1,001, 1,002, and blow out through your mouths. Okay, questions, comments, moral outrages? Well, in that case, if there are no questions, comments, moral outrages from the cyber world, or if there are any in our physical world here, I thank you all very much for your kind attention and for participating along with me, and I wish everybody safety and good health. And if you're looking for a chiropractor, we're taking new appointments here, both myself and my colleague, Dr. Phil Ross, who you heard from yesterday. And we look forward to doing everything we can to help you feel more comfortable living in your bodies.